السلام عليكم ورحمة الله وبركاته. طلابي الأعزاء، كل عام وأنتم بخير. أسعد الله أيامكم. إن شاء الله ينعاد علينا العيد وإحنا وأنتم بأحسن حال. راح نكمل إن شاء الله محاضرتنا لساليفري جلاند ديزيز من ما توقفنا. وصلنا إلى موضوع السيالوليثياسيس أو الساليفري ستونز. Another term here الكالكولاي. These are typically calcified organic masses that form within the secretory system of the major salivary glands. The etiologic factors favoring salivary stone formation may be classified into two groups. First of all, factors favoring saliva retention. مثل شنو؟ irregularities in the duct system, local inflammation or dehydration. Sometimes the patient might use medications such as the anticholinergics or the diuretics. They favor the formation of calculi. The second factor هي تخص saliva composition نفسه. As we mentioned before, the saliva constituents are different in ions or proteins. فهذه كلها بنسب طبعا يعني مقدرة بدقة. فأي خلل بهذه النسب لأي مادة مكونة للسلايفة ممكن راح تزيد لنا ال possibility of calculi formation. The higher rate for salivary formation in the submandibular gland is due to طبعا حتى لا تكون المعلومة منقوصة عندنا الميجر salivary glands احنا تحدثنا عنها. most commonly الساليفري ستونز راح تصير بالسبمانديبولار gland تقريبا 80 إلى 90%. followed by the parotid بنسبة 5 إلى 15%. بعدين السبلينجوال اللي هي نسبة تقريبا 2 إلى 5%. و very rarely occur in the minor salivary glands. why the submandibular gland is more prone? First reason هو tortuous course of Warthin's duct. الدكت مال السبمانديبولار جلاند هي يعني الباث مالتها ملتوي نوعا ما. فهذه الالتواءات يعني تحفز أو favors calculi formation. Second reason, the higher calcium and phosphate levels of the secretion contained within the gland. Number three, the dependent position of the submandibular gland that leaves them prone to stasis. طبعا الجرافيتي تلعب دور هنا. الريزن الرابع, the increased mucoid nature of the secretion. احنا قلنا يعني الساليفري glands هي تختلف من ناحية التايب of saliva. قلنا يا أما mucus يا أما serous يا أما mixed. Number five, since the submandibular and the parotid gland secretion is dependent on nervous stimulation, when there is an absence of stimulation, secretory inactivity increases the risk of stone development. يعني لما يكون أكو lack of activity. طيب, clinical presentation. أولاً patient with sialoliths or stones must commonly present with a history of acute colicky pain and intermittent swelling of the affected major glands during meals. يعني while he's eating نلاحظ أكو فد swelling يصير لأنه الفود طبعاً أكو ويا stimulation للسلايفة, فلا زال أنه الكانال يعني obstructed, فمعناها راح يصير عندي swelling. The degree of symptoms is dependent on the extent of salivary duct obstruction and the presence of secondary infection. Salivary gland swelling will be evident upon eating since the stone completely or partially blocks the flow of saliva resulting in salivary pooling within the gland ductal system. Since the glands are encapsulated and there is a little space for expansion, enlargement causes pain. Swelling will subside when salivary stimulation ceases and output decreases. يعني تقريبا البيشنت من يبطل activity of eating. Stasis of saliva may lead to infection. هذا الاكيوميليشن مال السلايفا على طول بالجلاند او الدكت راح يسبب لي طبعا انفكشن وعادة recurrent fibrosis ممكن وجلاند atrophy لانه يعني غياب النورمال function. If there is a concurrent infection, there may be expressible suppurative or non-suppurative drainage and erythema or warmth in the overlying skin. يعني منطقة الباروتيد مثلا أو السبمنديبولار نلاحظ أكو احمرار على السكن الخارجي اللي قريب على الجلاندز أو حتى خروج بص من الأورفيس مال الدكتس. طيب الكومبليكيشنز من الستونز أولا acute sialadenitis وهذا راح نجي نحكي عليه لاحقا. ductal stricture اللي هو تضيق الدكت أو ductal dilatation العكس. fistula و sinus tract formation. ulceration in the tissue covering the stone in chronic cases. هاي في حالة انهملت وبقت مزمنة. Diagnosis: plain film radiographs are helpful to visualize stones. They are readily available and result in minimal radiation exposure since small and poorly calcified stones may not be really identifiable. This modality is the most useful in cases of suspected submandibular sialolith. طبعا الأوكلوجال radiograph تؤخذ بدرجة 90 degrees from the floor of the mouth is recommended. كلش واضحة تظهر بها الستونز. However, other calcified entities such as phleboliths هذه الستونز اللي هي تصير بالبلد vessels, calcified cervical lymphadenopathy and arterial atherosclerosis of the lingual artery can also appear on these films. يعني نخلي ببالنا إنه ممكن نسوي فد تعتيم على الساليفري ستون نفسها. Stones in the parotid gland can be more difficult to visualize for several reasons due to superimposition of other anatomic structures. يعني هذه stones within the parotid يعني may be obscured and therefore the choice of radiograph راح يختلف. هنا راح ناخذ anteroposterior view of the face or an occlusal film placed intraorally adjacent to the duct may be useful in these cases. طبعا عندنا التايب اوف imaging أيضا contrast sialography using iodine contrast media. هذا حكينا عليه سابقا. may be used to visualize the parotid and submandibular ductal system. Sialography can also aid in differentiating calcified phleboliths اللي حكينا عليها قبل بالبلاد vessel from sialoliths since the former lie within the blood vessel whereas the latter within the ductal system of the salivary gland. Limitations of this modality include the use of ionizing radiation, dependence on successful ductal cannulation يعني يحتاج لها accuracy بالعمل, pain during and after the procedure and potential allergy للأيودين طبعا material. The use of contrast sialography is also contraindicated in the presence of acute sialadenitis. أعتقد احنا حكينا عليها قبل لأن راح أسوي لي separate للinfection. Ultrasound widely used as a first line imaging modality to assess the presence of calculi. Transoral sonography using intraoral approach has been employed as an imaging modality in suspected sialolithiasis. طبعا هو يعتبر non-invasive technique, less costly than other imaging techniques and may be able to visualize radiolucent calculi. Now we come for the treatment. During the acute phase of stones, therapy is primarily supportive. Standard treatment during this phase often involves the use of analgesics for pain, hydration, antibiotics to prevent or improve the secondary infection due to the stone, and antipyretics as necessary. The use of sialogogues اللي هي drugs or substance that increase the flow or stimulate the flow of saliva, like chewing gum, as simple as that, the pilocarpine اللي هو medication والسيفامولين. Massage and heat applied to the affected area may also be beneficial. Stones at or near the orifice of the duct can often be removed transorally by milking of the gland, but deeper stones require intervention with conventional surgery or sial adenoscopy placed to maintain patency of the duct. Extracorporeal shock wave هذه فالتكنيك allows the fragmentation of the large stones of any size or location، يعني فشي يشبه الاندوسكوبي. هذه ما يخص الموضوع الستونز أو الكالكولاي in the salivary gland. Now we come for another subject اللي هي extravasation, retention, mucoceles and ranules. أعتقد أنتم عندكم معلومات سابقة أو شايفيها حتى في صور. راح نبلش بالميوكوسيل. It's a clinical term that describes swelling caused by accumulation of saliva at the site of a traumatized or obstructed minor salivary gland duct. Mucoceles can be classified histologically as extravasation type or retention type. Extravasation mucocele does not have epithelial lining or a distinct border. The formation of an extravasation mucocele is believed to be the result of a trauma to a minor salivary gland excretory duct. Laceration of the duct results in pooling of saliva in the adjacent submucosal tissue and consequent swelling. يعني ببساطة التراما عادة راح تشوفون الميوكوسيل يصير بالليبيال minor salivary glands، يعني اللب من الداخل، وعادة اللور لب أو البكل ميوكوزا من الداخل، يعني الشيكي ميوكوزا. هذه هي rich in minor salivary glands، وعادة بدون شعور البيشنت يسوي لها تراما by biting بالسترس أو يعني بدون شعور هو يعضها، فهذا السلايفة تخرج خارج الدكت، وبالتالي يصير عندي فد swelling أو collection. The retention type mucocele is caused by obstruction of the minor salivary gland duct, often by sialolith أو periductal scarring or tumor. The blockage of salivary flow results in the accumulation of saliva and dilatation of the duct. Clinical presentation راح تصير عندي discrete painless smooth surface swelling that can range from a few millimeters to few centimeters in diameter. Superficial lesion frequently have a characteristic blue hue. وهسه نعرف ليش الميوكوسيل من برا راح ياخذ لون تقريبا bluish. Deeper lesions can be more diffuse covered by normal appearing mucosa بدون هذا البلو color. The lesions vary in size over time. Superficial mucoceles are frequently traumatized, causing them to drain and deflate. Mucoceles that continue to be traumatized are most likely to recur and may develop surface ulceration. طبعا كلش معرض even after removal الميوكوسيل معرض إنه يصير به recurrence. هذا the development of a bluish lesion after trauma is highly suggestive of a mucocele. Other lesions including salivary gland neoplasms or soft tissue neoplasms and vascular malformation should be considered in the differential diagnosis ولو هو جدا distinctive clinically الميوكوسيل. وهذا البلو هو أو الكلر اللي بالميوكوسيل هو نتيجة الإكسترافازيشن of the blood constituents. يعني تصير شبه هيماتوما. Extravasation mucoceles must frequently occur on the lower lip as we said. التروما لأنه is common البكال mucosa, tongue والfloor of the mouth, retromolar region and other commonly traumatized areas where mucus extravasation may be found. هذه كلها commonly seen in children and teenagers. التريتمنت conventional definitive surgical treatment of mucocele include removal of the entire lesion طبعا مع salivary gland والduct مالتها هذه minor salivary gland اللي involved. الريكرنس الهاي ريكرنس مالته نتيجة incomplete removal of it. Surgical management can be challenging since it can cause a trauma to the adjacent minor salivary glands and lead to the development of a new mucocele. Alternative treatment شافوا إنه هي بها نسب نجاح مختلفة اللي هي electrosurgery, cryosurgery يستعملون الليكويد نيتروجين أو الليزر. المايكرو marsupialization, intralesional injection of corticosteroids and sclerotherapy. Okay, now we come to ranula. هي أيضا form of mucocele, but the location is different. It's in the floor of the mouth, were believed to arise from sublingual gland يعني duct أو trauma. Possible causes include mechanical trauma to the duct of ravenous resulting in extravasation of saliva أو an obstructed salivary duct or a ductal aneurysm. The predilection of ranulas in the sublingual gland has been thought to be due to the gland's continuous salivary secretion that precludes effective sealing of the mucous extravasation via fibrosis, in contrast to salivary secretion in the parotid أو submandibular gland اللي هو dependent on gustatory stimulation. sublingual gland على طول في حالة activity. Ranulas are most common in the second decade of life وعادة بالfemales. Oral ranula remains confined to the sublingual space. Congenital predisposition towards development has been suggested, particularly in those of Asian ethnicity. In addition, particular anatomic variations of the ductal system of the sublingual gland may contribute to the formation of ranula. Clinical presentation. The most common presentation of oral ranula is a painless, slow-growing, fluctuant, movable mass located in the floor of the mouth. Usually the lesion forms to one side of the lingual frenulum. هذا فشي كلش distinctive للranula. However, if the lesion extends deep into the soft tissue, it can cross the midline. يصير فد bulging in the midline of the floor of the mouth. As observed with the mucocele, superficial ranulas can be also bluish, but when the lesion is deeply seated, the overlying mucosa راح تكون normal in appearance and color. The size of the lesion can vary. The larger lesions can cause deviation of the tongue. Diagnosis. Imaging may not be necessary due to its characteristic clinical appearance, but to rule out other cystic lesions مثلا thyroglossal duct cyst هذا نخليها بالdifferential diagnosis, epidermoid cyst أو cystic hygroma, fine needle aspiration, ultrasound, CT with contrast and MRI ممكن تستخدم for diagnosis of ranulas. The treatment طبعا هي eradicating both oral and plunging ranulas here to remove the sublingual gland surgically because this will almost certainly eliminate recurrence. Sublingual gland adenectomy combined with intraoral excision of the ranula suggested for a simple ranula Other procedures used for the treatment of ranula have include simple excision أو marsupialization, injection of a sclerosing agent silver nitrate أو botulinum toxin اللي هو البوتوكس، كلها بها نسب من النجاح. Okay, now we come to other subjects that is called necrotizing sialometaplagia. طبعا هو benign self-limiting reactive هذا موضوع انتبهوا عليه، هو reactive inflammatory disorder of salivary tissue. It can resemble a malignancy ولذلك هواية منها misdiagnosed ويعني تعمل لها unnecessary radical surgery رغم هي benign. The etiology is unknown ولكن يعتقد أنه هي local ischemic event, infectious process, or perhaps an immune response to an unknown allergen. لهذا قلنا هي reactive. Development of necrotizing sialometaplagia has been associated with smoking, local injury, blunt force trauma, denture wear, or surgical procedures. It has been reported in pregnant patients and those with diabetes, sickle cell disease, cocaine abuse, أو bulimia, and chronic vomiting. The incidence of its appearance to be higher in male patients and especially in those older than 40. Clinical presentation most commonly presents as painful, rapidly progressing swelling of the heart palate with central ulceration and peripheral erythema. The associated pain is often described as sharp in character and may precede mucosal changes. راح تترافق وياها numbness أو paresthesia in the associated area. هذه ممكن تكون early طبعا finding. The lesion are of rapid onset والسايز مالتها between 1 to 3 سنتيم، يعني مو صغير الليجن، لذلك هواي يشوفوها يعني بها مظهر خبيث يعتقدون إنه هي malignancy. Lesions occur predominantly on the palate, however it can occur anywhere salivary gland tissue resides. ممكن بالlips, retromolar, buccal mucosa, tongue, nasal cavity, and maxillary sinus. Although the lesions are usually unilateral, bilateral cases أيضا موجودة. Lesions affecting the heart palate clinically resemble salivary gland malignancies, particularly mucoepidermoid carcinoma أو adenoid cystic carcinoma. The rapid onsets of this disease may be a distinguishing feature. يعني يكبر بسرعة. Lesions often occur shortly after an inciting event to the area, such as local surgical procedure, restorative dentistry, or administration of local anesthesia, يعني injection. But lesions also reported to develop weeks after the dental procedure or the trauma. It's also not uncommon for lesions to develop in an individual with no history of trauma or oral habit، لأنه احنا قلنا هي موجود الفاميليال predisposition يعني بالموضوع أو بالhistory. الdiagnosis histopathologic and a complete clinical history, medical history، وطبعا clinical photos should be submitted with the specimen. التريتمنت تعتبر self-limiting condition typically resolving within 3 to 12 weeks. During this time طبعا supportive treatment و symptomatic treatment usually adequate, appropriate analgesics لأنه هو painful, antiseptic mouthwash للحفاظ على الأورال hygiene، الكلورهكسيدين طبعا ideal. Surgical intervention typically not required في يعني هذه cases. However, there are reports of resolution following debridement for particularly large lesions. يعني ينظف فقط المكان، وهذه اللي يصير بها infection with bacterial species أو يعني الكانديدا. هذه هي النيكروتايزنج سيالدينايتس أو سيالوميتابليجيا عفوا. يعني تشوفون الابيرنس مالتها كأنه malignant، ولكن هي في الحقيقة benign lesion reactive. Okay. Another subject هو الكيلايتس أو الشيلايتس glandularis. هو chronic inflammatory عفوا disorder affecting the minor salivary glands and their ducts, in which thick saliva is secreted from dilated ductal openings. هذه characterized by superficial ulceration, painless crustation, swelling and induration of the lip, and mucinous exudate is apparent at the ductal openings. الاتيولوجي يعني ما محدد أو معروف، ولكن أكو اقتراحات. هي autosomal dominant hereditary disease يعتقد، وبالإضافة إلى external factors عادة UV rays have been implicated as the condition occur more frequently in fair-skinned adults and albino patients اللي هم يكونون prone to this condition. يعني وجود أو التعرض العالي للsunlight وراح نشوفها بالأشخاص اللي هم بشرتهم تكون بيضاء. Additional proposed predisposing factors يعني poor oral hygiene, chronic exposure to sunlight والرياح winds, smoking والimmune compromised states. عادة بالmiddle age والelderly، وفew cases فقط reported بالwomen and children. Clinical presentation راح نشوف أكو thick saliva secreted from the dilated swollen labial minor salivary glands. هذه عادة adheres to the vermilion border of the lip, causing discomfort to the patient. Edema وfocal ulceration may also be present. عادة تصيب lower lip، ولكن ممكن upper lip أيضا أو palatal involvement. Differential diagnosis راح نخلي multiple mucocele، chronic sialadenitis of the minor salivary gland أو orofacial granulomatosis and actinic cheilitis. The treatment elimination of the predisposing factors، يعني أستعمل اللب بالم، مرطبات الشفة، emollients، sunscreens for those who are exposed to excessive exposure of the sun or the wind. Conservative treatment may involve using topical, intralesional or systemic steroids, systemic anticholinergics, systemic antihistamines أو antibiotics. Refractory cases require surgical intervention such as cryosurgery أو vermilionoectomy اللي هي يعني اللب and or labial mucosal stripping. Several reports documented the development of squamous cell carcinoma in areas affected by this type of lesion, leading some to call it a pre-malignant. هذه هي الكيس cheilitis glandularis. راح تشوفون أكو sort of crustation على اللب. أوكي، الموضوع اللي راح نبلش به هسه هو ما يخص side effects of the radiation therapy, especially for cancer patients. طبعا orofacial cancer. External beam radiation therapy is the standard treatment for head and neck cancers, and the salivary glands are often within the field of radiation, although therapeutic dosages of cancer are typically in excess of 65. Permanent salivary gland damage and symptoms of oral dryness can develop after only 24 to 26 GY. هذه هي الوحدة مال الراديشن. The etiopathogenesis of radiation-induced salivary gland destruction is multifactorial. ليش يصير هذا الدامج بالسليفري جلاند نتيجة الراديشن؟ أول شيء البروجرامد cell death، يعني يصير بيها apoptosis in conjugation with the production of reactive oxygen species and other cytotoxic products. Radiation associated impaired blood flow may also contribute to the destruction of the glandular, acinar, and ductal cells. The clinical presentation, acute effects on salivary function can be recognized within a week of starting the radiotherapy, with symptoms of oral dryness, thick, viscous saliva developing by the end of the second week. إذن هي أول أسبوع إلى أسبوعين. Oral mucositis is a very common consequence of treatment and can become severe enough to alter the radiation therapy regime. The mucositis appears as a sloughing of the oral mucosa with erythema and ulceration, والpain associated with it طبعا described as burning. حالة جدا مؤلمة للكانسر patients اللي يعالجون بالراديوثيرابي، لأنه تمنعهم حتى من الأكل الطبيعي أو يعني الاستمتاع بالأكل. Mucositis generally persists throughout radiotherapy, peaks at the end of the radiation, and continues for 1 to 3 weeks after cessation of treatment. تستمر تقريبا الإفكت مالتها حتى بعد يعني انتهاء الراديشن يعني أسابيع. By the end of the typical 6 to 7 week course of radiotherapy, salivary gland function is nearly absent. Hypofunction remains at a steady rate post-radiation, with only small increase to 2 years post-radiotherapy. This can be permanent if the major salivary glands receive more than usual dose. Permanent xerostomia or oral complications of salivary hypofunction impair a patient's quality of life. Signs and symptoms of radiation associated xerostomia راح يصير عنده burning sensation of the tongue, assuring of the tongue and lips, new and recurrent dental caries, difficulty in wearing oral prostheses, or increased thirst. Additional sequelae of this salivary dysfunction include candidiasis طبعا, microbial infection, plaque retention, gingivitis, difficulty in speaking and tasting, dysphagia and mucosal pain. هذه هي الميوكوسايتس. The typical appearance. تمام. نجي بالنسبة للinternal radiation induced pathology. بالنسبة للradioactive iodine هو standard treatment for cases of papillary and follicular thyroid carcinomas following thyroidectomy or in cases of suspected or known metastasis. Significant portion of radiation يعني iodine taken up by the thyroid tissue is concentrated and secreted through the salivary gland tissue, resulting in radiation exposure of the salivary parenchyma and possible damage. Standard doses of the radioactive iodine often cause obstructive duct symptoms, while hyposalivation from parenchymal damage is usually observed with larger or repeated doses of this treatment. Acute risks associated with radioactive iodine include ajusia يعني فقدان taste sensation, salivary gland swelling, pain, while long-term side effects include recurrent sialidinitis with xerostomia, stomatitis, and dental caries. In some circumstances, this treatment may lead to glandular fibrosis and permanent salivary gland hypofunction. A clinical presentation, the glandular effect of radioactive iodine can be mild to severe. Patients may be asymptomatic or may complain of parotid gland swelling, usually bilateral. Pain, xerostomia, decreased salivary gland function almost immediately after treatment. Radioactive iodine-induced salivary gland injury is irreversible. However, residual functioning salivary gland tissue is often present and responsive to therapy. Following administration of iodine to the patients should undergo an aggressive salivary stimulation routine that includes sugar-free lozenges, sour candies, and gums to stimulate salivary flow. This will aid in the clearance of iodine from the salivary glands and potentially decrease salivary gland damage. Stimulation of the salivary flow by these means, however, should not be initiated within the first 24 hours after iodine therapy because it has been shown to potentially increase the salivary gland side effect. ليستل المادة موجودة يعني بالتشو. بايلوكاربين والسيفاميلين اللي ذكرناها هذه هي salivary stimulants medication used before and after the treatment may decrease transit time through the salivary glands, thereby diminishing exposure. اوكي لحد موضوع الالرجيك سيالادينايتس راح اتوقف. نكمل ان شاء الله بمحاضرة لاحقة. تمنياتي لكم بالموفقية.